What if the real cause of chronic disease has been ignored in plain sight? Today we're uncovering leaky gut, the hidden link between autoimmunity, mood disorders, skin conditions, and the modern lifestyle that's making it worse. Welcome to Health Investigations, where we separate myth from measurable science. Before we begin, this video is for education only, not for medical advice. You walked into the doctor's office with real symptoms: stomach ache, fatigue, skin problems, autoimmune flare-ups. But because your labs were normal, doctors looked at you like you were crazy. The problem wasn't your mind, it was your gut barrier. Leaky gut may sound like internet slang, but in research it has a clinical name: intestinal permeability. And scientists have been studying it for decades. A 2006 peer-reviewed study in Gut described accurate methods to measure intestinal permeability, showed its connection to autoimmunity and inflammatory diseases, and demonstrated that restoring the gut barrier can calm immune dysfunction. So this isn't a myth after all, it's measurable science. When the gut barrier leaks, the immune system doesn't stay silent. It detects those escaping particles, bacteria fragments, toxins, undigested food as danger. That constant alarm can push the immune system into overdrive. One mechanism behind this is called molecular mimicry. When a foreign particle looks similar enough to your own cells that the immune system gets confused and begins attacking the body itself. A 2012 immunology breakthrough by Dr. Alessio Fasano analyzed evidence across human studies, disease models, and different research methods. The conclusion was clear: increased intestinal permeability is a major contributor to autoimmune development in genetic susceptible people. So the whole theory that you're doomed because of your genetics and that there is nothing you can do about it, it's simply not true. Genetic loads the gun, but a leaky gut pulls the trigger. If leaky gut can activate the immune system, could it also affect your brain? Yes, and here's the science. Your gut and your brain communicate constantly through something called the gut-brain axis. So when the gut barrier becomes leaky, inflammation can move through the body and signal the brain that the body is under threat. In 2018, researchers reviewed human and animal studies measuring inflammation in the gut alongside changes in brain chemistry. The evidence was clear. When the gut is inflamed, the brain signaling shifts and mental health suffers. That means changes in your mood, focus, and anxiety can begin in the gut, not the mind. And when inflammation continues, the body doesn't just feel different, it can look different. When the gut barrier fails, the immune system becomes more reactive, and that inflammation doesn't stay hidden. It often shows up on your skin. The gut and skin communicate through what researchers call the gut-skin axis. A clinical study of young infants with atopic dermatitis measured their gut permeability using laboratory markers. The study found that these infants already had abnormal gut permeability even before severe disease or allergies appeared. Imagine that. A baby's gut barrier already struggling before they can even speak their symptoms. That's why so many parents notice eczema flare-ups when their child has digestive issues. Those same inflammatory signals can trigger or intensify skin conditions like psoriasis, rosacea, and even acne in older children and adults. Our skin doesn't just show what's on the surface, it reflects what's happening inside the gut. When the gut struggles, the skin speaks up. So what is damaging the gut barrier in the first place? It's not just one thing. It's an entire modern lifestyle wearing it down. Our lifestyles lead to chronic stress. Our homes are over-sanitized, we don't spend enough time outside, and our foods are full of chemicals. All of that can disrupt the microbiome, inflame the gut wall, and weaken its natural defenses. And when your food are lower in key nutrients, we lack what the gut needs to repair that damage, so the barrier struggles to recover. The gut relies on key micronutrients like zinc, vitamin D, and iron. to keep tight junks strong and rebuild after stress. In 2022, researchers conducted a systematic review on zinc homeostasis, and the intestinal mucosal barrier. Findings shows that low zinc levels directly weaken the intestinal barrier and slow its healing response. When those repairs fail, permeability gets worse and inflammation rises. One factor alone might not break the gut, but in our modern world, many small stresses add up. Antibiotics are one of the biggest contributors to gut dysbiosis, an imbalance in the microbiome. They save lives, but even one course can wipe out large portions of our protective gut bacteria. And when those microbes are disrupted, the gut barrier becomes easier to inflame and more vulnerable to leaking. In 2024, a major long-term study followed children with genetic risk for celiac disease. Researchers measured zonulin, a marker of intestinal permeability, again and again over time, while tracking antibiotic exposure. The result? Children who received multiple rounds of antibiotics developed higher zonulin levels, signs of a weaker gut barrier, even before any autoimmune reactions appeared. This suggests something critical. Dysbiosis may be driving permeability years before disease is diagnosed. Antibiotics don't directly cause autoimmune disease, no, but they can set the stage for inflammation and loss of immune tolerance. And once dysbiosis takes hold, harmful and opportunistic organisms get the chance to overgrow and take control. When the microbiome falls out of balance, when good bacteria shrink and opportunistic microbes rise, the gut enters a state called dysbiosis. Dysbiosis doesn't just irritate the gut. It strains the immune system and puts pressure on the intestinal barrier. But here's a surprising discovery. Correcting dysbiosis can help reseal the gut. In 2018, a randomized placebo-controlled clinical trial tested a probiotic yeast called Saccharomyces boulardii in patients with Crohn's disease in remission. Using the standard lactulose mannitol test, those receiving S. boulardii showed significant improvement in intestinal permeability compared to placebo. Because when opportunistic organisms are kept in check, the gut can start healing. Leaky gut wasn't pseudoscience. It was the warning before the storm. Our bodies have been shouting for help, but the system wasn't listening. Patients were dismissed, not because evidence was missing, but because the system wasn't built to ask why we get sick. The truth: calm inflammation, heal the gut, and the immune system can be reprogrammed to stop attacking itself. It was never in your head. It was in your gut the whole time. And now, change begins with us. Trust your gut, literally and figuratively. Question what doesn't make sense. Fight for answers when no one else will. Because we know our bodies best. And together, we can demand a healthcare system that truly heals. This is just the beginning, and it starts with you. Thanks for watching Health Investigations. Like, comment, and subscribe for more videos like this. Stay critical, stay proactive, and stay healthy.